Today we are going to be talking about chronic illnesses and their impact on mental health and talk a little bit about what it's like to live with them with our guest speakers. So in honor of May itself is Mental Health Awareness Month, so very fitting that we're talking about these topics today. But before we get into talking about mental health conditions, we want to give a little bit of a background like we do every session about what exactly is Invisible Illness Awareness Network. Invisible Illness Awareness Network is a nonprofit that focuses on raising awareness around invisible illnesses, chronic illnesses, and disabilities. And something that's really integral to the mission of this organization is helping students at different universities start affiliate organizations at their schools so they can also take leadership roles around raising awareness about invisible illnesses and engage in education with peers, especially those involved in pre-health careers. So we can really move forward with a new generation of hopefully healthcare providers and anyone who wants to know about invisible illness in a more inclusive environment that will benefit patients and families. And then specifically what we're doing here tonight and what we do twice a month is called the Invisibly Aware Series. And so this is the 2 virtual meetings we host every month. And so one of those meetings is usually a very educational, informative meeting about the conditions we're going to be talking about that month. And then the second meeting is focused solely on guest speakers sharing their experience living with or treating those conditions. So today's meeting that we're at is our guest speaker meeting, and we're going to have some wonderful guest speakers share their insights and experiences. And we always like to do a little plug of our social media before we begin. So this is all of our different handles. So the Instagram, the YouTube, the website, and the link tree with a bunch of our resources. And you can actually scan the QR code right up here on the slide for access to the link tree. And then that will also give you access to the events calendar and newsletter for future reminders about meetings. And we also like to do an access check before we begin. So for any images, we do like to share that we're going to be doing verbal image descriptions. But if anyone feels that they need other accommodation needs, please let us know via chat. If you want to privately message one of us, Stephanie, Sarah, or me, we're definitely here to accommodate. And then also a quick thing we like to do before anyone speaks is give a little bit of a visual verbal description. So for me, I would say I'm a young South Asian woman with black hair. I'm wearing a green shirt. And yeah. And if you have any questions at any point during this, please feel free to put in the chat. You can message Sarah if you want your question to be asked anonymously. And at the end, we'll have time for questions with our guest speakers. And like always, we like to say we are not offering medical advice. If you are concerned about any of these issues that we're going to be talking about today, we ask that you please talk to your doctor. And then another thing that we really like to emphasize is no 2 people with the same condition have the same experience. And we are not experts on these topics, but we've done a fair amount of research, and our guest speakers obviously are going to be sharing their personal experiences and are experts on their narratives. So today our focus specifically is on the intersection between chronic illness and mental health conditions. And so at this junction, we're going to be covering generalized anxiety disorder, depression, post-traumatic stress disorder, medical PTSD, and medical trauma. And so these are kind of a lot of the conditions we're going to be touching on through our conversations with our guest speakers. And we do like to say just a content warning because of the topics we are covering today. There may be things that are triggering for some people, so we like to give that content warning ahead of time. And one more final takeaway before we jump right into our questions with our guest speakers is that mental illnesses are just as important as physical illnesses. They are often very much hand in hand. And something that's really important to emphasize is mental illness can often cause direct physical symptoms. You can see a lot of manifestations of mental illness directly in the body. And just like any illness, mental illness is not someone's fault. I think that this is such a big takeaway point to drive home, and it can often be forgotten because of that invisibility aspect of it. So it is not as simple as trying to calm someone down or make them happier. It's often out of people's control. And another thing that we like to talk about is how generalized anxiety is not just anxiety. It is extremely debilitating and extreme. It's not your typical everyday anxiety of like being worried about a specific event. It's typically all consuming at all times. And similarly, depression is not the same thing as being depressed. And medical trauma is real. So many medical professionals do not take their patients' concerns seriously, and this can have very serious damaging repercussions, not only psychologically, but can delay diagnoses, which we've talked about a lot in this club, and cause physical and mental harm on the way. And finally, as we always say, be kind to others and yourself. You never know what someone is going through just by looking at them. So without further ado, I'd love to introduce our guest speakers. And so we have three wonderful guest speakers with us today: Shannon Linford, Jill King, and Monroe Marshall. And what we're going to do, just to kind of explain the structure of how this is going to work. We are going to just be asking questions, and there's no specific order. Please feel free to chime in whenever you feel the moment moves you. If there's a question you don't want to answer, please do not feel like you have to. But it's a very informal kind of setting that we're just going to be getting to know a little bit about your personal experiences, if that sounds good. All right, so if we could actually start by just everyone doing a brief introduction, if they don't mind, that would be wonderful. If anyone wants to jump in and start.
I'll do it. My name is Shannon. I have been pals with Sarah and Stephanie for a couple of years. I've known Sarah for quite a while through Dysautonomia International, and I am a patient advisory board member with Dysautonomia International and have been for, if I admit how long, it will age me, and I don't want to do that. I have several conditions, including dysautonomia and depression, anxiety, ADHD, like the whole works. I try to keep a blog where I talk about those conditions, and I will share too much information tonight, and I apologize in advance. And I apologize I did not give a description. I am a 30-something white female with light brown hair and glasses.
Thank you so much.
Sure.
All right. I can go next. I've known, gosh, I'm trying to remember when exactly Sarah and I met. It's been a few years online. But I run the Students with Disabilities Advocacy Group, and we just sort of connected through being student networks and trying to build advocacy on campuses. But a lot of my work is revolving around disability justice on campuses and accessing accommodations within higher education. But as for me being here, my name's Jill King. I have a mitochondrial disease that includes chronic pain, dysautonomia. I've lost a lot of my vision to it. But secondary to that, I've also got, gosh, I feel like it's like an alphabet for so many of us. ADHD, autism, OCD, and CPTSD. I believe that's it. I believe that's all I got for you. Yeah. A visual description. I am a young white woman with brown curly hair and glasses. Yes.
Thank you.
I'm Monroe Marshall, and I got involved pretty recently through Instagram with this organization. And I'm a 28-year-old white male with rainbow glasses and brown hair. And I work in the field of mental health and suicide prevention. And I have my master's in public health. I live with multiple mental health conditions like OCD, depression, and anxiety. And then I am also autistic and health-wise, that diagnostic process only started within the last few years, so it's kind of ongoing still. But some of them include bilateral peripheral neuropathy, EOE, which is eosinophilic esophagitis, um, uh, idiopathic hypersomnia, and also just things like chronic allergies and I'm under autoimmune testing.
All right, thank you so much for those wonderful introductions. And if you don't mind, we can just start getting right into the questions, if that sounds good. All right. And I believe you all should have a copy of the question list already, just so if you want to read it directly, but I'll just be jumping around a little bit. And so first off, I kind of just want to start with, I know all of you touched on it a little bit, but speaking a little bit to what your experience with mental health conditions is, and if you don't mind specifically, what is your diagnosis, a little bit more in depth. I know everyone mentioned it, but what was the process like getting diagnosed and that kind of initial, I guess, introduction to that? And anyone can jump in.
I know for me it was a little complicated. I was diagnosed autistic really young, but after some speech therapy, they were like, "Oh, she's fine now." But I think we all know it's not as simple as that. So I just learned how to mask. That's basically what I learned from therapy as a 3-year-old anyway. So that's something I'm still like as an adult kind of like relearning that like that is a part of my identity and that like there's not shame in that. That's I feel like that's a process that we all go through with certain disabilities, especially when it's like these ones that feel so inherent to like who we are and how we behave. That's how it really felt for me when I was diagnosed with ADHD, which it was when I was 20. Before that, it was like, oh, all these weird idiosyncrasies of mine, they're just mine. There's something with me, when that wasn't the case at all. It's just I act differently, and there's nothing wrong with that. As far as the OCD and CPTSD, that's really growing up, going to therapy. I really just had a random combination of diagnoses thrown at me because they were like, oh, she's just going through it. We don't know exactly, but she's going through it. But it's really taken like, therapists while I was an adult to really, get into the nitty gritty of like, hey, what's going on through your brain? What are these neuroticisms? How are we getting where you're at? That made me learn that, what I was dealing with was OCD. It was a result of childhood trauma and medical trauma. So just to say that I very much relate to the whole, oh, I'm still figuring it out. And I feel like that's so valid. So I wanted to know that.
I can relate to that a lot. I started getting all of my physical and mental health symptoms, a lot of them at the same time, right around when I was like 10, 11 years old. And my mom took me to a psychiatrist because I had actually asked, like, Mom, how much does it cost to see a psychiatrist? Because members of my family were going to this doctor. And that was her immediate, like, oh, no, the kid needs to see a doctor. So thankfully she listened to that instinct and took me, and the doctor saw me immediately and knew my family history, and they were like, oh, she's a depressed and anxious kid. And I was put on Paxil that very visit. And then over the years, I just kept collecting diagnoses. So it's like every few years, my story just gained more depth. It was, we uncovered more layers as I grew up. So, a couple years later, we add OCD. A couple years later, we add ADHD, and it's always ADHD without the hyperactivity. I don't know why it's that and not ADD, but they're very specific about that. And then there's also conversations of, is there some key like CPTSD or not? You know, where's the line for that? Does it need a label or does it not? How do we honor those symptoms that are happening? Do we need to give a diagnosis? And having those conversations in therapy, which have been very interesting, of figuring out of does what you're experiencing need a label for it to be valid? That's something I've struggled with a lot, because I've also felt like, well, I need to have a diagnosis for this to be real. And my therapist has challenged me a lot of like, do you, or does the fact that you're experiencing it make it real? And, you know, we don't necessarily need to have, you know, a diagnostic code for it. So that's kind of been my journey for the mental health part of it.
I relate so much to the diagnosis and validity thing. When I was in therapy since I was in early elementary school, but no official diagnosis was given until I was 14 with OCD. And that was actually at a neurologist because we were already connected to one through my sibling who was there for epilepsy. So I just got in. And at first, the person at neurology, when I was 12, said that the symptoms were all like typical teenage things, which made no sense because I was describing pretty like horrific imagery. And I don't know why that was called typical teenage things. But then the second time I went, it was taken more seriously. And that's when I started treatment, medication, and then also for the first time, like therapy with an actual diagnosis, which was nice. Sorry. Therapy for an actual diagnosis, which was really helpful. It was probably the first time I had any benefit from therapy. And then later on, I think it was in college, as I was exploring, like I was realizing that I was LGBTQ plus community. I was with another psychiatrist, and actually, yeah, it was my first time at a regular psychiatrist compared to the neurologist and a therapist. And there I was diagnosed specifically with the depression and anxiety. And I also participated in a OCD clinical study, which was really cool. And there they actually, my dad went because at the time I was still, I wasn't a minor, but they still wanted a parent who could say about like early childhood experiences. And that's where like they suggested they wanted to rule out autism. And my dad was like, yeah, no autism there. And that was the first time I really heard of any potential connection between what I was experiencing and autism, because I always related so much to my autistic friends and everything. And that diagnosis didn't come until I was 23, I think, which was oh wow, no, it was like 25. I was thinking I was younger than I am. I was 25, and it all made so much sense because BPD symptoms have also been mentioned, and BPD has also been suspected, and that's also often tied with autism. So that's where all the whole thing, like the diagnostic and like having a diagnosis or not and everything. Like I got my autism diagnosis, but my mom was like, why did you have to get that? Like you're out of school and everything. You can't benefit from any accommodations like from that. Why'd you have to get it? And she didn't really understand that it really like meant a lot to me, as much as like also being undiagnosed autistic is completely valid. It just really solidified things and made my growing up so much more understandable, and the ties that had with my mental health. It all like made a lot of sense.
Thank you so much. Yeah, I know that a lot of times in this club we talk about the power of diagnosis, but Shannon, especially what you were talking about with your experience of not necessarily having that label and talking with your therapist about whether just having those experiences makes it valid really has got me thinking about the power of diagnosis, but also just the power of lived experience. And I think that that's something I'm still thinking about and working through. So I really appreciate everyone sharing. And I guess we can move on to the next question if that's okay. Um, and specifically, we're wondering if you could speak a little bit about what your day-to-day life is like with symptoms. So I know every day is not the same. We have better days than others. But a typical day, does anything make your symptoms worse? Does anything help with your symptoms? If anyone wants to share about that.
Mhm. Recently, oh,
I
I'm sorry.
oh, do you want to go or should I?
You can go ahead.
I have to keep an accessible catalog of things that make me happy on the hard days. So when I get up on my bad symptom days, which are the depressive spells, the anxious spells, when I am so anxious that I'm shaking and crying, I have to have a ready, super accessible way to watch videos that distract me and make me laugh so much that I can't even think about whatever is hanging above my head. So I did a project for myself where I made like a Tumblr with like 1,000 videos that I think are funny, and I have them all like tagged meticulously. So if I'm like, today I need to watch a video with Pete Holmes in it, and I can just very easily find everything. And it's so like, if you see it, you'll be like, oh yes, of course this woman has OCD. And it is worked out really, really well on the anxiety days where, and also the days where I'm just feeling like so terribly numb, but I also know that I need something to push a little bit of feeling into my life. Um, and that's what I do. That's my lifeline.
I love that. I really love
Same. That's awesome to hear.
I will share that. I will post that link on my Instagram if anyone wants to follow.
Yeah.
I know for me, like I have an emotional support animal. Her name's Fig. She's a cat. We love her. But having, something, outside of myself to take care of on really rough days, I know how to take care of Fig. I know how to be grounded. Like she can petting her and loving on her can help me feel more grounded. So, she's my bestie, and that's very helpful on bad days. Um, I think in part I do a lot better when I have something to work towards. Um, I just finished my bachelor's, so I'm on summer until I start my master's degree. And I'm just like trying to find something to do with myself. Thank you. But, just kind of working on my master's degree, I'm looking forward to that because it's kind of, I get to go down that research rabbit hole. I get to focus on those hyperfixations, and that gets to be my job. So just kind of finding what works for you and what works with your brain and its idiosyncrasies has been really rewarding for me. Leaning into writing, leaning into research and creativity has been really big for me.
For me, a lot of the stuff that I've been learning and exploring to manage symptoms, especially the ones that intersect like the mental and the physical, I've picked up recently because I completed a virtual intensive outpatient program, which was like so phenomenal for me in starting to take steps towards actually finding things that work. I'd say in terms of symptoms, the thing that impacts me most is the hypersomnia, which we treat it as narcolepsy without cataplexy, because of some of the symptoms don't really fit with idiopathic hypersomnia, but more so fit with the narcolepsy. And that leads to extreme, I always like am punishing myself for falling asleep throughout the day and really feeling underproductive at work and everything like that, where that is what impacts my mental health the worst at this point. It used to be way worse though, but I have things I do such as um I remind myself of different with work when I like realize that I'm still getting good views and that the productivity is measured differently for everyone.
Mm.
And like it's a 40-hour work week, but you could accomplish the tasks in different hours than the typical schedule you're set up for. So I often am doing things outside of the hours because I don't stay actually awake during the whole period that I'm supposed to. Um, Mental health wise, I really have been inspired since with my wife and baby are on this call. The baby's probably not actually, she's 2.5 months old. But they have like been both really amazing in helping me um through these um battles and everything. And I just find like the baby cats and my wife are just really um wonderful. Like I'm always looking at pictures and everything like that. And I work from home 4 or 5 days of the week, thanks to reasonable accommodations. And it's nice when I'm just like struggling and I could walk into the room and they're there. Yeah, and I love that. I love the idea with the lists. I am obsessed with lists and everything. So I am probably gonna start something like that.
I highly recommend it.
Thank you so much for sharing. And it's really great to hear all these different ways that you've like learned about yourself and what works for you. And I think it takes a lot of strength to be able to be so like sure and certain about the things that work for you. So that's really awesome to hear. Um, Moving on to something we touched on a little bit, I think, in earlier responses. But in terms of treatments, what treatments have you tried? What's worked? And also at the same time, what hasn't worked? So I know some of us mentioned medication earlier. So if you could touch a little bit on that, if you're comfortable.
I am extremely treatment resistant. I have been on almost every medication on the market. I had to make a list of all the medications I had tried, and I lost count at one point. So that's my claim to fame. And but I got the chance to do transcranial magnetic stimulation, and it quite literally saved my life. I did one round of it in 2016 and I went into full remission from depression. I had gone from not being able to leave my house to leaving my house, doing things, being active. I did relapse with depression, but my doctor was so interested in my case that he was like, you know what, let's just start trying some stuff with TMS and you. And so over the next 18 months, I had TMS on and off. And he tried different machines and different protocols because there are 3 main different machines for TMS. And you know, it took a long time, but he finally was like, you know what, let's just kind of stop and see what happens. And so when I started TMS in 2016, I really could not leave the house for anything except doctor's appointments. And then 2018, we stopped TMS. And in March, I got a full-time job. So, or no, sorry, it was part-time. That's a lot. It was a part-time job and then it became full-time. So TMS, I still have my relapses every now and then, but the relapses, like I'm just crawling out of a relapse right now, to be totally frank. I was really in the depths for a couple of weeks and I was like, oh my God, it's happening again. And I was like, I'm gonna be such a liar and a fraud when I'm at the when I'm doing this invisible illness thing. And then I was like, oh no, things are getting better because we did the work. But TMS got me to that place where I've been able to build upon so much. So I'm the poster child for it. I will sing its praises forever. It obviously won't work for everyone, but it really, really, it saved my life.
I had a really similar experience with TMS, actually. I had been in and out of therapy like since I was 11. I had tried just about all the medications, same way. And God, how old was I? It was 2020, so I was probably about 19 when I did it. And that was the youngest, I was the youngest person who had done it at that office. And I remember that being a big deal. Because apparently, like, the corpus callosum, which that's a part of the brain, and that's what they're messing with the magnetic stimulation. Stephanie, I saw your message asking about like basically how it works. So in part it's magnetic stimulation in that part of the brain that's in part trying to rewire what's going on in your brain. And it can be really helpful for treatment resistant depression in particular. And it was incredible. I had someone that I spoke to about it, and they said it was like they would still get depressed, but they wouldn't go nearly as far down as they used to. Like it was much more, you were able to live with it. Like I know before that I wasn't able to live with it. Like it wasn't happening. And you know, I have certainly had my relapses with depression as my physical health got worse, which was after TMS, just a certain amount of reactions to the medical trauma I was being exposed to. Unfortunately, a certain amount of it, having a reaction to that made sense. But it wasn't like the entire lifetime of depressive spirals that I'd had where that's all there was. And it was really incredible to find it somewhere, find something that worked. It was really miraculous because I had kind of gotten to a point where I was like, that's not going to happen. We're going to go, but it's not going to do anything. Nice to be proven wrong.
Exactly. Like for me, it just felt like it gave me the foundation where I got to do that really, really good therapy work. And I got to really like dig in and like finally get to that place in therapy where I got to like unlock some stuff. Because I had been struggling to really make a breakthrough in therapy. Like I was just stuck for a while. And then once I had this, once I had TMS, I was finally able to like break through there. And I was like, oh, this is what people feel like.
Oh my God.
Yeah. And if anyone ever has any questions about it, I think Jill would be able to answer, and I would be happy to answer, but it's not painful. It's literally just a magnetic stimulation, like it's a magnet against your head, and it feels like tapping, but it's not like nothing.
I will say for me it was painful, but also
never mind.
Everybody's different. But I have fibromyalgia, so it's kind of like a lot of things that aren't painful might be painful for me. So that's something I've kind of acknowledged when talking with other people. It's like, for me, it was actually incredibly painful. But yeah.
I'm glad you're here.
For me, I've been pretty responsive to medications, but the dosages and like things have been added on in my case. Like I've been on the same medication. There's one that's like commonly treated, like OCD, is fluvoxamine's one medication that's like very common, especially in youth diagnosed with OCD. And I was prescribed that in 2010 and I'm on it still. Except the dose went like to the max. It's really annoying because in terms of how things work and all, I've gotten better, but I haven't always been good at medication adherence and still struggle a lot, regardless of what kind of methods I try, like with alarms, the pill cases and things like that. And they had like an extended release thing, which would be one pill a day instead of having to cut pills and everything like that. But if that stopped being available in my area, apparently. So I had to go back to the other, which it still works just as good. It's just easier for me to miss. But aside from that, when I was being evaluated, like I mentioned, I never really got a diagnosis of BPD, but I am treated for the symptoms. So I tried initially one medication that when I was hospitalized for acute pancreatitis, they couldn't figure out a reason. So they thought it was like this medication that had one case study showing a person who was on it where that was attributed. So they took me off of it. And I ended up going on a different medication, which is fine and everything. But then I still got pancreatitis, so it probably wasn't that. Um, but yeah, and it's just annoying with sometimes when insurance changes and they try to challenge different medications on. Um, but I'm doing pretty well on medication. Therapy has never been my strong suit. Um, Probably due to being forced into it when I was younger and the scapegoating of being the one in who's the issue in your family.
Mm.
As I went to therapy with my mom and I literally have a page in my diary where I wrote, I hate the name of my therapist because she was a lovely person, but I was forced to go that I was just like hating her. And then when I was older and actually wanted to go to therapy, it got better. And like most recently, like I mentioned, the intensive outpatient, that was my best experience ever with the combination of group therapy, um, family therapy, and then individual therapy. It was like 9 hours a week of group, 1 hour a week of individual and one of family. And that was the best model for me, especially the group. And I'm really, really hoping to get into that group aspect again. Because currently luckily the intensive outpatient program I'm in, they have a free alumni program. So I do still get to go to non-clinical groups, including 1 hour per session. So 3 hours a week was like fun things like art, writing, meditation, just to try everything out to see what works for you. Um, and that's some of the stuff we still do in the alumni groups. So even though I'm out of that program and my current therapy sucks because they make it like, for some reason, they think 30-minute sessions are good enough. And you barely get any, and then like, it's ridiculous. But these alumni programs are literally why I'm still like, okay, compared to my actual clinical stuff that I'm currently in.
Thank you so much for sharing that. I think everyone's responses really speaks to how everyone's experience with a certain diagnosis is different. What one treatment works for one person is very different for another. And also just the nuances of what treatment looks like. I think this is really eye-opening to hear about. This is actually not on our list of questions, but just listening to your responses really got me thinking. I know we've all heard that cliche saying of healing is not linear. There's hills and valleys. I know everyone has touched on relapses. I guess one question I have is what advice would you offer to someone who's kind of struggling with coping with those ups and downs and kind of coming off of like a really good period and then going into a low period? What advice would you give someone for coping with those volatile changes?
The fact that life is a sine wave. I went to see this psychiatrist for a consult, and he worked at National Institute of Mental Health, and he literally had me graph my moods over the course of 15 years. And we were graphing sine waves. and it was going up and down just like that. And I felt like I was in pre-calculus in high school again. And it was just so consistent how it would, it just went up and down, but it kept going back up again. And just last week, I felt so low and I was like, this is it. My mood's never going to improve again. And I emailed my therapist and I was like, I'm done. It's like we're not going to improve. Like this is the lowest. I don't see this ever improving. And she was like, remember how many times you've pulled yourself out of this. And I think the emphasis of being told that you did the work, because no matter what happens, it's always you are the one getting yourself through this. Other people are helping you, but you are the one who carries yourself through these hard times. You are the one that gets yourself to the top of the wave again. And it's just everything balances out. And the bad times will come again, but so will the good times. And it's so easy to say this during a good time, but there's just so much data to prove that things get better.
Yeah. I know this was something, I think one of the questions was like, what would you tell someone who was recently diagnosed with mental health condition? And I think this would apply here as well, but you don't have to do it on your own. There's a lot of, talk about self-care and reaching out for help and seeking help. And, you should seek help. You should seek professional help and take care of yourself as best as you can. But, for a lot of reasons that it's not always as simple as that, whether you can't afford care or you don't know how to take care of yourself. Like it's new to learn how to take care of yourself. I had to learn how to take care of myself as an adult, certainly. So I would say, having a community, leaning on that community, because it is going to come up again. But I know when I'm in those lows, you don't get through those lows for yourself, or at least I don't. I have a hard time doing that. And that's a work in progress, certainly, as well. But having a community and leaning on that community and having a lot of belief in what that community care can do is really powerful for me. So, yeah.
That's one area where I think the social media aspect has come into such a play. I always see it for like, there's even apps now specifically for connecting with community with similar diagnoses, but also just connecting with the communities in general of people with lived experience. And they're often the people who move you forward. Even like, because the peer connection is often something that is very much needed, that they need to introduce to the clinical space, and they're like peer advocates and everything are emerging, luckily. Just need to increase the pay for it so people actually could stay in the position. But that peer connection's amazing, and there's many ways like now for people to connect, to have more of a likelihood to be able to connect, because I know there's access issues from every area. But aside from the community connection, a while back, I saw, and I have a shirt that says, "What if it gets better?" Instead of saying like it gets better, because when you're in that spot, even if you have had times where it gets better, you might not be able to think about that or actually picture it. So the what if it gets better is something that's like that hypothetical for me. For example, it's always been huge because in I'd always be scared, for example, as much as I hated school, I'd be scared to miss school because I'd be scared to miss something cool. So that's something for me that if something's really bad and I'm like, I don't think this will ever get better, I'm like, what if it does and I miss something amazing? Like, and I'd be so mad at myself for missing it. That's like something I always think about.
delete my answer and just take Jill and Monroe's and just use theirs and just know that you deserve all the credit in the world for all the hard work you do.
I loved
And
your
then
answer too.
I did. I appreciate your answer. It's for sure.
But, no, your answers were so good. Just delete mine.
No, everyone's answers are really great. And I think they all emphasize both the role of community and self and how neither should be forgotten. They really spoke to me, so I appreciate that. And kind of going off of that, talking more community-wise, support structures, we kind of want to ask a little bit about like institutional structures and what sorts of support have you felt in more like professional settings or school settings. I know we talked about getting diagnoses at different ages. I know, Monroe, you mentioned not getting a diagnosis until you were out of school, so maybe it applies more in the work setting. But what do you feel, have you gotten a lot of support, or is there a lack of support in these institutional structures that you're in?
I was really failed by my school system as a child and teenager. My school refused to give me a Section 504 despite having multiple doctors write letters, having my therapist show up to a meeting, having a copious amount of documentation because I presented as a very competent, you know, child, teenager. I masked really, really, really well. I showed up happy and alert and really excited. And my teachers would see me interacting with friends and be like, oh, she's lovely. She's having a great time. She doesn't have any problems with her. And then I would go home and have a panic attack and scream for hours because I couldn't handle the pressure of school. But I was smart enough to do everything and I was capable, but I was crumbling under the anxiety. And the school people couldn't understand that the home version of me couldn't handle the pressure. And so they just decided that I was lying and manipulating. And even though we had plenty of documentation, they decided to break the law for several years. I did get my Section 504 because my mother's relentless, but that caused me to lose a lot of faith in institutions and higher power, and has made me very wary and nervous of things like HR, of higher education, of schools, of anything like that. So when it comes to seeking out support at work, at anything like that, I am thorough. I document. I am nervous. And even though I put things out on the internet for everyone to see, I just see it as another means of documenting. And
I relate to
Stephanie,
that.
yes, supportive parents are everything.
Because I feel similarly about like what my K through 12 experience looked like. Because I had these diagnoses, I was struggling a lot, but I was also masking, and I was intelligent and I was capable. But you can be all those things and you can be struggling. Like, these things are so often together, or at least for me, it's always been together. Like, my best work has often been done when I have been struggling, because I'm in tune with myself. I'm in tune with what makes me tick and what is making me be an advocate in the first place. But I know for me in higher education, basically going and having to advocate and trying to get these accommodations, whether it's in higher education, the workplace, or whatever, it's always a fight. And I don't know about y'all, but my body's exhausted all the time. My mitochondria doesn't work. There is no powerhouse. We are tired. What do you mean I have to go and fight for basic things? It is exhausting. And that's really why I started my nonprofit, which is focused on, just building community spaces for disabled students. If we're going to have to go, we're going to have these fights, we may as well lean on one another, and we can advocate better together. So I'm looking at my notes. And with doctors, just like within like the medical industrial complex, I'm jaded at best about that. Not gonna lie. I have had like my physical issues dismissed because I had a complex mental health history. They were like, "Oh, she's been dealing with mental illness her entire life. That's obviously what this is." It's really not, though. It's really not. Like, I literally brought a letter from my psychiatrist saying her mental illness is dealt with. Like, she is coping. Something is physically wrong with her. Like, do your job. Thank you. It still took a while, but like the fact that it's the sort of thing where it's like a doctor's word is going to be treated as gold, no matter how much you are so intimately familiar with what your body is doing and how it's struggling. It makes me incredibly frustrated. But I just think more and more we need to be amplifying that lived experience, because it's like, it's complicated. It's complicated. There's a lot there. And for a lot of instances, you don't understand it unless you've been in it. I think I answered your question. Okay.
Both of your responses actually helped build what I'm gonna say, because I had much of like a like it helped me. I kept thinking like, yes, this is so relatable. So while like many of my diagnoses came after with school, um, I had oh, I just saw my wife's message pop up. I had in earlier, like my school had nothing to do, like I know many people, like now there's so much more in terms of mental health in schools in a lot of districts, but there was nothing in mine. And like I had these diagnoses, but it wasn't mentioned to my school, probably because of the family shame and stuff. Like I remember in 10th grade, I not rebelled, but my dad was mad because like on this, we had to make a poster with our um big things that happened during our life, and I had like my OCD diagnosis on there, and he made me take it off. So I just left a blank space. And then once I entered a contest for OCD, and I did get to the finalists, but then they like my family emailed them to take my last name off because they didn't want it to show up with that, and they wouldn't share it, and you needed votes to win. So they're amazing now. They're amazingly supportive now, and it's fantastic. But the whole connection with like this, I actually work in systems of care. So all the different sectors like of a society coming together to like, so services are more easy to find for everyone. Um, I'm seeing all these things in mental health in schools, and it's fantastic. But there's still like these gaps, especially with developmental conditions labeled developmental disabilities and mental health. You're either one or the other, even though they're usually linked. And that is a huge area that we struggled with. And I see how that impacted my life and my brother's. We both were, one of us labeled developmental, other labeled mental health. We both had like completely unaddressed issues because of that lack of connection in the silos between all of the different sectors. So if any of you are interested, systems of care is like a big thing that many states are working on to link all that together.
Thank you so much. I noticed that we are very short on time. I didn't realize that we were approaching 9, but these conversations have been really helpful. So thank you. I guess if we have time to one wrap up final question, is if the public were to know one thing about mental health conditions, what would you want it to be?
I feel like there's such a misconception that like just because you have the same diagnosis means you're going to present the same way, or that just because you presented one way when you were doing badly before, that's how you'll present in the future. But I feel like, our experiences, our culture, our access, just all these things that they inform our experience with mental illness, right? Like it's not as simple as just you had this. You don't develop your mental illness in a vacuum. This stuff is all connected. So I think kind of addressing that, one size doesn't fit all for mental health, like at all, much less when you're looking at different diagnostic criteria. Yeah.
I feel like I'm cheating with my answer because I get to say yes, Jill, and yes, whatever Monroe's going to say, and I get to use my answer, so I really get three answers. My answer is mental health and illnesses are becoming a much more like less stigmatized thing in the world today. But in other ways, there are like these pockets of society and dark corners of the internet where people are growing really reactionary communities, and really beginning to kind of reject modern science and reject research and reject a lot of ideas and go so far towards what they deem as research that they say, oh, no, you're not depressed. You can fix your depression with raw milk and rubbing garlic on your feet and stuff like that. And some people, it's going to work for some person every now and then. And if it works for you, God bless you. I love it. That's amazing. But we cannot discount the fact that the majority of people are curing their depression based on research-based methods. And I am very frightened by the fact that there are a lot of people putting out messages on the internet about follow my newsletter to get a cure for depression, and trying to recruit people that way. And long story short, the thing I would say to the general public is please do not put your health into the hands of somebody who says, follow my newsletter and give me $1,000 and I'm going to cure your depression, because that's not going to happen. It really, really worries me and scares me because I have been at this for, 21 years now, and depression doesn't get cured by following somebody who considers themselves a god on the internet.
I love that both so much. What I'm gonna add is with the focus on intersectionality, a lot of time, like when people, there's always studies, and these are important, that show like different communities have higher rates of mental health conditions, which is great, important research to be had, but it always gets misconstrued by people who want to prove their points, taking it as that other identity is the reason for your mental health condition, rather than society's treatment and accessibility issues are what influences the mental health condition compared to the identity itself. So especially in terms of like, with my experience, LGBTQ community, being told that I should sort out my mental health issues before taking steps to become who I am, because the mental health is because I'm too confused and too upset and everything like that to actually take these drastic measures, while those drastic measures are what's going to prevent it from getting worse for me. But there was that lack of connection with that. So it's always like that, where intersectionality is important, but people really need to not interpret it as someone's identity being the cause of their mental illness.
Like the
Yeah.
nuances of the directionality, like
Mhm.
I think.
Like one of the, basic things they teach you when you start stat for psychology is that correlation does not equal causation. Like just because these things happen to look that way does not mean it's that simple. There are so many other factors. There's access, there's this, there's that. it's not as simple as one thing. Nobody's mental illness is as simple as one thing. So yeah.
Thank you so much for all three of you. I really appreciate you being so vulnerable and sharing very personal experiences. I'm sure everyone here on the call is also very appreciative. I know I learned a lot. And before we close out, would anyone like to share any final thoughts? This is also a great time. Anyone on the call, if you have any questions for our guest speakers, you can put them in the chat. And if you would like to anonymously message Sarah with a question, that is also great. And yes, echoing Christy's message, so grateful for your time today and just your vulnerability, because I know it's really hard to talk about these things.
I actually am
Thanks
gonna
for
ask a
having me.
question real quick. Oh, sorry, Jen.
Fine.
I would like to ask a question just for those future healthcare professionals out there. If you guys were to have a message for someone who wants to learn more about mental health, wants to learn more about chronic illness and how those things are connected, what would you advise them or guide them to in terms of resources or anything that you think would be helpful for them to acknowledge in their journeys of trying to educate themselves more?
I'm not super familiar with any like direct resources that acknowledge those things exactly. I want to say Mental Health America has something about basically chronic illness and mental health, so maybe look into their website. But I know I've had doctors in the past who basically would say to me, you know, I know this is really difficult. It's really tough to come to terms with the fact that you are going to be in pain for the rest of your life. How are you dealing with that? I know I was really humbled and grateful that I had a doctor basically speak to me on a level like that, meet me where I was, and open up that conversation. So I think just kind of acknowledging that human connection there can be really helpful among doctors and patients. You know, having accessible mental health resources in mind as well can be helpful, because I know even if I didn't already need therapy, dealing with the medical system and a rare disease, I'd need therapy for that. So yeah.
I'd say conferences, like looking up just different conferences happening, a lot of them have virtual attendance that could be free, and many have the try just listening to voices of lived experience, things like that. And many conferences do have medical tracks or whatever tracks, and they're recorded often too. So I think like just looking into things, and when you do have a patient, often you could learn about it. Like you could go home and research once you know like what your patient's working with and everything. You could learn more in the moment and then like have stuff to talk to and relate back to them later on.
Yeah, I wasn't quite sure what the question was. I'm sorry. But if doctors need to learn more about their patients, they could also just ask what resources the patients are using to learn about what they have. Because like for me with my journey with being diagnosed with dysautonomia, I would recommend the Dysautonomia International website to my doctors, and they would be like, oh, this is actually very helpful. And I'm like, yeah, I know, you should use it.
Yeah, sorry, my question was kind of wordy. It was more so like just how can, future healthcare professionals best support patients as they keep learning about these things and want to learn more. But that was all of your answers were very great. Thank you.
Yeah, thank you so much. And before we head out, I just want to also do a quick announcement about our, I think on the next slide, so next month in June, we're going to be covering circulatory conditions. So if anyone on this call right now is interested in learning more about those, we'll be covering congenital heart disease, hemophilia, and median arcuate ligament syndrome, also known as MALS. And so that meeting is June 4th at 8 p.m. And then just like today, we'll have another guest speaker meeting later in June on June 18th, which will be on the same Zoom link. But I just wanted to plug that in before we close out for the evening and say one final thank you so much, Shannon, Jill, and Monroe, for your time. I learned a lot today, so thank you.